Hello there, my name is Neyser Castillo-Obregón and my partner Michelle Cabanillas-Carbonell. Today I will talk about the topic analysis of ICT for asthma patient monitoring, a scientific literature review between 2015 and 2020. These are the fine points to review. The first one, introduction. According to the latest estimate from the World Health Organization, asthma disease is affecting the lives of more than 300 million people worldwide, and by 2020 this number could reach 400 million patients. Asthma is one of the chronic diseases that occurs when the patient's airways become inflamed, preventing the passage of inner air. The methodology, type of study. For the preparation of this article, the systematic review of scientific literature defined in the Prismat Guide will be used. Research questions. The proposed research questions were the following. The first one, what are the ICTs used in the follow-up of patients with asthma? And the second one, what is the best ICT to help in the follow-up of patients with asthma? Search strategies. In order to provide an evidence-based response to each question posed for development of the research, a search for scientific articles was carried out in the scientific database of Scopus, IEEE, Explore, Science Direct, and EBSCO, finding a total of 86 articles between the years 2015 and 2020. When conducting the search for our research, the following keywords were considered: monitoring or analysis or asthma and ICT. And in this graphic we can see the search strategies. Okay, inclusion and exclusion criteria. The following exclusion and inclusion criteria showing in this table were applied for the study in order to provide an answer to the question posed. Extract and analyzed articles. The results of the investigations revolve around the findings in the articles, the consultations in scientific journals, and their certification by name and year, which were 86 articles found on the impact of ICTs for monitoring patients with asthma. With the results, 32 articles were obtained that meet the inclusion requirements regarding the review developed. The research were carried out in 4 databases available in the repositories worldwide. The analysis process that was carried out was as follows. Distributions of articles according to the database, EBSCO, IEEE Explore, Science Direct, and Scopus. In this graphic we can see the distribution of articles according to continent and database to which it belongs. Here, distribution of articles according to ICT applied to patient monitoring and year of publication. This is another graphic to ICT most used in phone articles. Um, Here we can see the number of articles to each category. For example, 24 to algorithm to classifications, 6 for mobile patient system, 3 articles for the web system, and 1 article for the nanotechnology and artificial intelligence. Discussion. The first question, what are the ICTs used in the follow-up of patients with asthma? According to the information collected from the article shown in Table 2, it can be seen in the Graphics 5 the ICT used in the last 5 years, 2015 and 2020. In addition, the tools were classified by means of article published and focused on the monitoring of patients with asthma, obtaining as a result that in the year 2020, according to what is observed in the Graphic 5 and Graphic 6, the classification algorithms have had a great impact in terms of ICT's publication, showing a great number of published articles referring to the subject in the Science Direct scientific database, especially in the European continent as shown in the graphic 4. The second question, what is the best ICT to help in the follow-up of patients with asthma? According to the graphic 5 and the graphic 6, it is observed that in the year 2020, classification algorithms are the most implemented tool to help patients with asthma. The classification algorithms make it possible to identify the degree of complexity of the disease suffered by a patient with a certain symptomatology, such as recording to the tracheal sounds of forced exhalation, calculating the duration of the tracheal sounds of forced expiration. To finally track the analysis of the algorithm, provide the diagnosis that serves as a useful guide of avoiding errors for the final diagnosis provided by the health personnel. And the last one, the conclusion. This research addressed relevant issues regarding communication information technology (ICT), such as the classification of tools most used in the years 2015 to 2020. In addition, in this research, it was achieved through statistical data to publicize the most implemented tool in recent years to date. Thanks to this research, it was possible to obtain knowledge and contribution focused on the process of monitoring patients with asthma in the world through the use of technology tools that are currently in constant innovation. Nowadays, there are information tools to be able to fight asthma. Science, it helps us to be able to analyze critical cases, and these technologies are already used in several parts of the world. For the future research, it is suggested to deepening the classification algorithms, which allow to identify degree of complexity of the disease and provide an accurate diagnosis, validating also the degree of effectiveness of these algorithms used. And thank you very much.